My name is Dr. Judy Gooch. I'm a doctor specializing in physical medicine and rehabilitation. And I work with a lot of people who have had brain injury and who've had other neurologic conditions. And my goal is to share with you the ins and outs of navigating life after a brain injury or other neurologic conditions. I have a lot of videos on my channel, so please consider subscribing, and you can look at previous videos or see videos that will come in the future. Today, I'm going to talk about Deborah. Deborah had a brain injury. She's a 64-year-old woman, and she was in a bike accident. She lost consciousness for a few minutes. She went to the emergency department in the hospital, and they evaluated her. She had a negative head CT scan. They said she was fine, and they sent her home and arranged no follow-up. So, in the days after the brain injury, Deborah felt foggy, kind of confused. She had headaches, she had neck pain, she had vision struggles, she was dizzy, and often she felt nauseated. She also couldn't remember conversations very well. Somebody would tell her something and she would forget it an hour later. She couldn't remember where she put things, like her purse. Well, a month later, she was still struggling. She was getting afraid and frustrated. Why was she not back to normal? So she called her primary care physician, and the physician sent her to physical therapy for her neck pain and basically told her to rest and not do much of anything. Well, the symptoms continued, and so she saw a concussion specialist. Well, the concussion specialist sent her to vision therapy because she had visual problems. But the therapy actually made her nauseated, so she quit. She became more and more frustrated. She became more and more anxious, and she just couldn't get back to where she was before the injury. She was irritable with her family. Her relationships suffered. So a few months ago, she came to the physical medicine and rehabilitation clinic. Now, in that field, we often deal with people who have had brain injury. At that appointment, we talked about brain breaks. Even after a mild brain injury, the brain can become easily overstimulated and your symptoms can worsen. A 5 to 10 minute break every hour can really prevent this overstimulation. Now, before the accident, Deborah rode her bike a lot. She exercised all the time, and she hadn't returned to exercise. Well, exercise is really good for the brain, and so we talked about a gradual return to her exercise. We also reassured her that she could improve, but it would take time. This gave her hope and decreased her anxiety. Now, anxiety makes all these symptoms of brain injury worse. She also started cognitive therapy with a therapist that's experienced in dealing with people with brain injury. They helped her schedule her day to alternate stimulation with rest, and they worked on her thinking skills. Well, last week she came back, and she's improving. She still has some struggles with her memory and her vision. She's much less anxious, and basically she's slowly getting better. So I want to give you some key points of treatment and recovery after mild brain injury or concussion. First off, a normal brain CT scan does not mean you did not have a brain injury. A CT scan might show significant areas of bleeding, but it often doesn't show some of the subtle changes that you might have with brain injury. Next, follow-up after brain injury is important, especially if you have ongoing symptoms. Also, many concussion clinics have sprung up in the past few years. Some of them are great, maybe some of them not so great. Check out reviews and recommendations. Also, physical medicine and rehabilitation physicians or physiatrists often specialize in brain injury treatment. Not all, but some do. Also, you can improve. Often it takes time. Cognitive therapy can help you improve. Brain breaks and exercise are some simple things that you can do that can really help. Address anxiety and depression because they can definitely worsen symptoms. If you found value in this information that I shared in this video, please consider liking and subscribing to the channel. It helps the channel grow and it helps this community grow.